Happy Friday, and welcome back to the Indegene Digital Summit. My name is Sanjay Parikh. I'm one of the founding members of Indegene, and it is my pleasure to be the host for the keynote session this evening, actually this morning, afternoon, evening, wherever you are. Well, as part of the life sciences and healthcare industry, we are in the midst of an unprecedented era of change. Some may call it extreme disruption, although that seems to suggest that this is a one-time event. Instead, I like to think of it as more of a metamorphosis and evolution as the industry steps into the future while preserving its link to the past. In these circumstances, how do business leaders strike the right balance so that they preserve the things that are working while preparing their organizations for the future? And who better to help us understand the challenges and the opportunities that lie ahead than my guest in this keynote session, Arpa Garay. Arpa is currently the president of Global Pharmaceuticals, Commercial Analytics, and Digital Marketing at Merck Sharp Dome, the trade name of Merck & Company. She leads the commercialization of inline and pipeline assets, as well as business development across specialty, hospital, and chronic care businesses, totaling to approximately $20 billion in net sales. Additionally, she's responsible for data analytics, digital marketing, and partnerships worldwide for headquarters as well as country operations. With over 20 years of experience in management consulting and business leadership, Arpa's track record includes P&L leadership, corporate strategy, business development, data analytics, and digital transformation. Within Merck, she has held several leadership positions prior to her current role. These include being the Senior Vice President of the US Vaccines Business, Managing Director of Merck in Norway, therapy area leadership positions, and several others. In addition to her commercial experience, she has represented the company on joint steering committees of joint ventures, as well as worked on the merger with Schering-Plough and the spin-off of Organon. Arpa started her career as a management consultant at the Monitor Group. She has been externally recognized for her leadership as a G100 Next Gen leader, C200 member, Fortune's Most Powerful Next Gen Women, Business Insider's Global Top 30 Under 40 in Biopharma, and Philadelphia Business Journal's Top 40 Under 40 Business Leaders. She holds a Bachelor of Science in Economics from MIT. She has lived in 5 countries, visited 70, and loves to travel with her husband and 3 children every chance she gets. Wow, what a resume. It is therefore my unique pleasure and privilege to welcome Arpa today for this keynote session, which we have structured slightly differently, more as a fireside chat, during which I hope to be able to get her views and insights on the digital transformation of the industry. As always, please feel free to post questions in the chat box, and I will try and pose them to Arpa if possible. Arpa, welcome to the Indegene Digital Summit. It's delightful to have you join us today.
Thank you, Sanjay. It's a pleasure to be with all of you and really looking forward to our fireside chat.
Wonderful. So let's get started. And while introducing you, I couldn't help to be in awe of the number of achievements that you seem to have packed in over the course of your career, and it seems like you're just getting started. So before I dive into some of the more topical questions, can you tell us a little bit more about your journey thus far and how you discovered your passion for healthcare?
Sure. So I will say my passion for healthcare started at a very young age. As you mentioned, I've lived in several different countries. I was born in India. I lived in the US, moved back to India, Hong Kong, Singapore. And over the years, as we were spent a lot of time in Asia growing up, it always occurred to me that the 2 fundamental sort of pieces of what makes society successful is education and health. Given my personal bend towards math and science, I ended up actually taking a very keen interest broadly in healthcare and medicine and learning about, what drives differences in different countries and different populations and socioeconomic areas. And that's really what sparked my interest, I would say, growing up. And I continued to go down that journey. I explored, potentially becoming a doctor. That was a path I was looking at. And then looked at public health opportunities. And during my consulting years is really where I started to fall in love with the industry and what the possibilities are for the industry to have broad impact on healthcare. So that's sort of my journey. It started at a fairly young age.
Yeah, I'm delighted you pursued that passion. Otherwise, it would have been a loss to the industry itself. But let me just unpack that a little. Obviously, you've had an exposure to so many different nationalities, cultures, health systems, etc. And how has that, to some extent, shaped your thinking about how you approach your current role and the future of the industry as a whole?
Yeah, absolutely. I'd say there's probably two key areas where it's really shaped how I approach my role. One is around talent and building, diverse teams that can really reflect the needs of our customers around the world. And when I say customers, I mean that broadly from everyone from patients, families, communities, as well as governments, because the context of where we operate is so important. And so the talent that we bring in, I think is very, very important that we're making sure that we reflect those needs. Related to that from a business perspective, having seen so many different healthcare systems, different affordability challenges, different access to healthcare across different countries, my team is very much focused on, as we're developing new medications, we're looking at future launches, we do try to take, rather than a one-size-fits-all approach, rather look at, how do we get to the broadest access possible? And what are the different potential solutions we have that will look different in a low or a middle income country versus a high income country? And how do we put that into our planning to get our medicines and vaccines to as many people as possible?
Got it. Let me then kind of, obviously you've got a wide array of things that you're kind of responsible for. You have experience in various things, but given that we have just, less than an hour to kind of unpack some of them, I'm going to kind of dive a little bit more into the whole area around digital transformation, getting future ready and stuff like that. So let me start off with more of a motherhood and apple pie kind of question, right? So, there's so much said in the industry about next generation customer experience, customer excellence, et cetera, digital, multi-channel, all that kind of stuff.
Right.
But as a leader, right, if you had to imagine a world that offered an ideal customer experience in the healthcare life sciences industry, could you share with us your vision for what that experience would look like? Because a couple of days ago, I was in a discussion with somebody, and somebody said, when we talk about digital experience, tell us what your North Star is. And I'm still struggling to kind of define what that North Star could look like. I'd love to hear your thoughts on that.
Right. So I think that's a really important question. I always start with a broader look at what would great look like. Now this goes beyond obviously the commercial side, which is a side that I play in, but I would say start with just imagine a world where you can more easily and readily diagnose diseases earlier, right? Whether it's leveraging algorithms or data or even different kinds of diagnostic systems, right? Which are really leveraging technology and data broadly in the digital sense. Imagine a world where then with the patient and the physician and the healthcare system, you can get to more personalized choices on what's going to make the most sense for you as a patient who may be in need of a medication. A world where rather than worrying about, am I taking it appropriately? Am I doing the right thing? How do I manage side effects? Where you've got these technologies or experiences that actually help you predict potentially even, you may have the following 3 side effects. This is normal. Let us connect you via video or telehealth to another provider and help you get to that outcome that you're looking for with your medication, right? And then lastly, access delivery, right? And we've learned a lot about this during the pandemic. It's, I would prefer to have my medication delivered to my home, right? For certain diseases, convenience is really, really big for me, right? I'd rather do a video chat than wait in the doctor's office for 2 hours. So I think if you think about the total journey, for me, it's about how do we make the total experience better for a patient so that, in the pharma industry, we spend a lot of time saying, what outcomes can this medicine provide to people? I think where we need to go is, how do we get them to that outcome, right? Because in the real world, people aren't operating under very strict clinical parameters, right? So
Sure.
how do we leverage a broader ecosystem, whether it's our own technologies, whether it's partners, to help get that patient to a simpler, more convenient, more sort of individualistic approach to getting to where they need to go?
And just a corollary to that, I mean, obviously there's, at the end of the day, it's all about the patient, wanting to make sure that the patient gets the right medicine, the right time, in an affordable manner.
Mm-hmm.
But in several parts of the world, and even in the United States, and of course in several other parts, there is a gatekeeper in the healthcare professional, right?
Mm-hmm.
So when you think about that utopian kind of customer experience,
Mm-hmm.
keeping the HCP at the center,
Yep.
are the principles pretty much the same, or is there a slight nuance which you think about when you're talking to your teams and thinking about it?
So I think the broader principles are similar. I will say, from an HCP perspective, we do try to ground more on what is it that our customers holistically need, so that we're giving them valuable information, or we're giving them valuable content or an experience that helps them work with their patients to get to better sort of shared decisions and outcomes. So I think a couple of the pivots, which sound fairly basic as you think about, other industries, are, how do we approach them from more of a portfolio perspective instead of brand by brand, right? How do we shift it to, what does the customer need versus what does each brand want to communicate? There's some basic tenets around how do we shift more from a push model to a pull, right? So when they need certain information, they're able to get what they need when they need it. And then I'd say, just this broad concept of this omni-channel, you'd mentioned sort of multi-channel, there's a lot of words out there, right? But
Right.
how do we meet their needs where they are, when they're, and what is most relevant and most convenient to them as well? So I think a lot of the principles are similar, just a slightly different bend from a physician perspective, because they're more sort of not following the patient day to day throughout the entire journey. So the patient, I think, actually needs more support. And then the other customer I'll put out there, which I think is a significant customer growing in importance, is the payers, right? The payers, the government. So how do we get them relevant content and information? Oftentimes it's around value demonstration, real world evidence, helping them to understand which subsets of patients are going to benefit the most. How do we enable them to make better decisions for their populations by engaging with them in a different way?
Got it. And you mentioned, of course, when you look at other industries. So I think it's safe to say that even now, when it comes to thinking about a technology-driven, data-first kind of customer experience, and I hate to use the word customer, let's call it stakeholder experience, right?
Mm-hmm.
That the healthcare industry still kind of lags other industries, right?
Yeah.
And so at this stage, couple of questions. One is, what other industries should we be drawing inspiration from? At one level, if you think about it, it's all very nice and easy to say, we want to make every experience like Amazon or Netflix.
Right.
But hey, we're in a different industry.
Right.
So are there certain select things that you're picking up from
Yeah.
other industries? And then I'll get to the next part of that question.
Yeah, I'd say the two industries that have been interesting to me to look at and watch are, one, I would say it's a financial services industry.
Mm-hmm.
It's an industry that's heavily regulated in a different way, but heavily regulated. It's a very personal engagement for, finances are very personal to people. And there are multiple stakeholders along the way as well, right? They work with institutions, they do B2B and B2C, similar to healthcare. And many of the companies have gone through massive transformation on how they have leveraged data and digital technologies to get to better user experiences, to get to better product development. So I'd say that's one industry that I think is certainly very interesting that we can learn from. And I say within healthcare, some of the smaller, more orphan disease companies, I think, are experimenting a lot more in terms of, how do we get better, deeper patient insights? How do we actually support the patient more broadly throughout their journey, all the way from diagnosis to care delivery? And I think those are also within industry, maybe a couple of examples that we can continue to learn from.
Okay. And in that context, given all the learnings from other industries, what we are seeing in our industry, et cetera, what do you feel are no longer pioneering approaches? The things that are pretty much now table stakes, whether you're a rare disease company, a gen med company, et cetera, but in the business of actually providing life-saving therapies.
Right. I would say from a table stakes perspective, there's this whole acknowledgement of the proliferation of data. I think that the industry understands we ourselves have a lot of data, but now many of our customers and payers have a lot of data, plus many consumer companies have a lot of data that rounds out that customer, right? So I'd say the first piece is just beginning to actually start assimilating different data sources to get a deeper understanding of our customer base, regardless of which stakeholder is now becoming table stakes. This whole notion of omni-channel experiences and being, I would say, 10 years ago, we were primarily face-to-face in a lot of our engagements, right? Particularly with the physician and the policymakers and the payers. And now it's table stakes to have a broader view of how to engage across multiple channels with our customers. I'd say that's absolutely table stakes. And then I think related to that, it's how do we then start taking a more holistic view of how the data, the insights, and the technologies are working together to deliver business outcomes, right? Being more disciplined on measuring ROIs, measuring impact, and using those insights to look at different ways to allocate resources over time. So those, I would say, are becoming table stakes across the industry. Right. And some are doing it better than others.
Sorry, and where, in that context, where do you see us as an industry right now on that spectrum of where we need to be and where we are in terms of the way we actually synthesize, organize data, as well as kind of leverage it? On the one hand, as a rear view mirror to see how things happened or how well we did, but more importantly, to help prognosticate what we ought to be doing. Are the challenges still at the level of organizing the data so that we can start using it in near real time? Is it more in the models that we have at the moment, or is it actually more of a behavioral challenge? We still believe in our own empirical experience rather than sometimes what the data is telling us.
Yeah. I would say if I had to prioritize the biggest barrier, it's culture and mindset. The industry has been extremely successful over 100 years now, right? So we have done things a certain way that has made us successful and has truly impacted millions of lives around the world, right? So I think there is a little bit of sort of the mindset of what I'm doing today is working. And that's a little bit of a behavior shift and a cultural shift. I'll say from a data and analytics perspective, I think companies are getting better at understanding and acquiring data sources, right? A lot of companies playing in this space. I'm less concerned about can we build the predictive models. I'm more focused on, are we asking the right questions to be answered? And then when we answer those questions and build the algorithms, right? Whether you outsource that or do that in-house, I think there's a real challenge in terms of, am I going to change my behavior as a result of what the data tells me, right? And that's the piece around trust, because data is sort of in a vacuum. So we tend to rely more on our past experiences rather than really believing that this algorithm is going to give me some insight that's going to have a bigger impact on my business than what I would have done otherwise. So I think there's a little bit of conservatism and risk aversion that still exists. I think the capabilities absolutely exist, right? We've seen it across industries. I think it's that sort of cultural piece that's going to be the biggest challenge.
And just, in your experience, almost in every large company such as Merck, there would be experiments. There are some things that have been, there are places where it's worked and people have shown that as a proof of concept. It takes time to try and spread the belief across the organization. Are you beginning to see, especially on the whole customer experience side of things, actual quantifiable kind of differences in the use of in the outcomes because of the use of data, appropriate data in near real time?
Yeah.
Are there any examples you can share with us?
Yeah, absolutely. I would say there's been a lot of experimentation around the world. So the advantage of a global company is you've got a lot of people trying different things, and we try to capture those learnings, share them, and celebrate the successes to inspire others. On the broader sort of omni-channel digital marketing side, I'd say is where we've probably made more progress, where we've seen actual customer impact in terms of relevancy, in terms of lift in business. We've invested in capabilities like next best engagement, which I believe there was just a panel on, to help guide a lot of that work. Now, we are limited by technology, depending on what country you're in. So not all of our subsidiaries around the world have the same capabilities, which is something that we continue to monitor and address, who's ready for that next thing. We can't roll it out globally. On the data and analytics front, we are seeing some early examples of success, right? I'll give a very sort of recent and relevant example. During the pandemic with COVID, one of our products is an anesthesia product. It's not a big product for us, but it's part of our portfolio. And the team saw, with all the intubations and all the hospitalizations around the world, they started to see some slow, uptick in demand, right? So the team actually worked with the data scientists to say, can you help us actually build a predictive model based on the pandemic and the epidemiology and external data sources from Johns Hopkins and others to help us predict where are we going to have the greatest need for this anesthesia product. So we can actually increase supply and production. We can also get ahead of if certain countries are going to need supply before other countries. Obviously, from a regulatory perspective, you got to change packaging, you got to change your supply chain. So that's an example where, the business working very closely with the data scientists, as well as with supply chain, were able to make a real impact to patients and to the business because they increased supply, they got more patients out, more doses out to patients, and they were able to meet a real public health need. So that's just one example where I'm beginning to see more and more teams seeing the value and the power of even more of these predictive models going forward.
Okay. And I want to segue into something around, you talked about culture and stuff like that. And so whenever we're talking about any transformation, right, especially in emerging capabilities, there are different pools of talent within the company, right? You will need a balance of new talent, emerging talent, and of course, existing talent. And as I said in the prelude to this, at least one of the things that we see, at least in the life sciences industry, is unlike, let's say, a Netflix blockbuster video, which is so, very, very kind of discontinuous in the disruption. In life sciences, we reckon that this is going to be more of a continuous kind of disruption. So in that kind of situation, how do you think about organizing your company so that you bring the right kinds of capabilities together without disrupting the overall culture, because a 100-year-old company, at the end of the day, culture will trump strategy every day of the week, right?
Right. It's a great question. I think it's probably the number one challenge for any multinational company. So I think the way you framed it is absolutely correct. As you're building new capabilities, you're going to have to bring in new talent that has, so for example, whether it's digital marketing or it's analytics, what have you, right? You're going to have to infuse the company with some new talent. But as you start doing that, you have to pair them with existing business leaders who understand the complexity of the healthcare market, understand what the real opportunities and challenges are for their customers. So that customer knowledge and market knowledge is incredibly important. And find a way to actually marry the two so that you're preserving the best of the culture, you're preserving that mission focus, that healthcare always has. You're preserving sort of that customer-centric knowledge, but infusing in new capabilities. So I would say it's almost, you've got to mix the teams up. You can't have them fully separate. The other piece around change management, and this has been a learning journey that I've certainly learned quite a bit over the last couple of years, is you also need to acknowledge, right? People are working really hard and really fast to deliver on business. So to then go into a country or to a P&L owner and say, I want you to deliver all these results, but I also want you to start building capabilities. And I also want you to innovate and experiment, is a lot, right? Because oftentimes you're not giving them more resources, you're just telling them to do more. So my personal experience is sometimes having some sort of centers of expertise that supplement the day-to-day business work to start experimenting. And they're almost like the consultants, right? Like, we're here to help you. As you start doing that, getting the data, getting the learnings, and sharing the successes is what's then going to ultimately lead to broader transformation.
And as a business leader, when you think about that, and is that the investments that go into kind of creating those new capabilities, at a very broad level, does that typically require you to kind of say, all right, this is an investment I'm going to make up front, right? At a central level.
Yeah.
And then over time, I'm hoping that it will start getting into everybody's individual budgets. Yeah. Or is it from the get-go something which, have you seen one approach work better than the other? Because if it's coming out of your budget, then, hey, it's free, so it has no value anyway.
Yeah.
Right.
Yeah.
Whereas if I'm paying for it, there's a slight difference. So,
yeah,
how have you dealt with that?
So I'd say it's a mixed model where the investment to build a new capability has to come from the center, because usually those bets are long term, right? You're betting on, I'm going to build this capability, it's going to help the company for the next 10 years. That's very difficult trade-off for someone who's running day-to-day operations, right? So I think the investment in the actual capability needs to come from the center, has been my experience. But then the actual investment on the work, right? I want help building an omnichannel experience for my product or for my customer, or the work on, I need help building an algorithm to answer this question that I have. That budget, I believe, needs to actually sit with the countries and the business, because that gives them the power to actually prioritize what work needs to get done for them. And it also creates joint ownership. So if they are asking for certain work and paying for it, the chances that those insights or those campaigns or technologies are utilized go up significantly as well, right? Because there's that joint ownership, joint accountability, and that close collaboration with sort of the business insights as well as the capability expertise.
Got it. I have a question which is kind of a little open-ended, so feel free to kind of go in any direction you want. It's more about, we talk about innovation, right? And we keep talking about, and it's very hard sometimes to define innovation. You can never define innovation. If you could, it wouldn't be innovation in the first place. But within the context of your organization or things that you've seen outside, even if it's not in a pharma company or mother pharma company, what are there some examples of innovation which have truly inspired you, which says, man, that's the kind of stuff we should be doing as Merck and leading the industry?
Yeah. So I'll start with your first question on what is innovation, because it's a very sort of utilized term now across all industries.
That's true.
And I will, I don't want to misquote, but one of my favorite quotes is from Thomas Edison. So I don't have the quote in front of me, so I'll paraphrase. And essentially, the way Thomas Edison thought about innovation was, if there's a better way to do something, find it. And for me, that actually takes the fear of this big, hairy, complex innovation away a little bit, where to me, if you've just got a better way to do something, even if it's a small improvement to our current process, that's innovation. That's value, right? That's value either to the company or is value to the patients or the physicians or the payers. So for me, I like to think of innovation as just anything that is better than what we've done before versus just this, super complex big ones. So with that context in mind, I think, look, a lot of companies, a lot of industries have, embarked on different levels of innovation, right? You always hear about the example of Kodak, and, thinking about, sticking with an older technology when it's time to pivot potentially to a newer one, right? Your example on Blockbuster and Netflix, those were sort of game-changing innovations, right? With healthcare, I tend to agree with you. I think it is an evolution. I think the pace of the evolution is actually increasing because of the proliferation of data and technology. But I think if the focus of innovation in healthcare continues to be, how do I show the greater value of my inventions, right? Because all we do in the labs is innovation.
Right.
If I can get patients to better outcomes with a seamless sort of a decision-making process with physicians who need to have information at their fingertips at a cost that is more affordable and actually shows my payers and policymakers that I'm saving them money. It's an investment, but it's an investment that's worth making. That's sort of the goal, right? It's that what I would call the quadruple win. The healthcare system wins, the physicians win, the patients win, and the companies win, because we're all getting to better outcomes. So that's sort of the focus of innovation. It can be something as simple as, can I just make my packaging simpler for you to use? All the way through to, can I partner with a digital therapeutic to get you to better outcomes, right? So I think there's a lot of different levels of innovation.
Actually, my next question was going to be about digital therapeutics and really about, so much about the beyond the pill kind of solutions. And, yesterday we had a couple of very interesting presentations, one by the former CIO of Amgen, and then one by the chief data science officer in the global commercial strategy organization of Janssen. And both of them talked about some of these digital apps, things that have actually done better patient adherence or been able to kind of help in diagnosis in remote areas and stuff like that. So some really cool, fascinating stuff, right? But in that kind of a situation, given that, you've got the Apples and Googles and several other super smart Silicon Valley startups in all over other parts of the world, what do you see the role of companies like Merck in the pharma industry in itself in that kind of thing? Do you think pharma companies will essentially continue to do what they do best, that is develop novel therapies, right? And leave that development of these digital therapeutics, et cetera, to other players? Or do you think this is something that they will want to bring in-house somewhere because they'll say, it's much more agile if I can bring my knowledge along with technology together in the same outfit rather than have to create these partnerships?
Right. So I think that is $1 million question. I'll say it's probably a midterm, long-term question. At least in the short to midterm, I don't think that pharma's ready to embark on creating their own digital health apps or digital therapeutics. It's not our core competency, right? Our core competency today is around inventing medicines and vaccines. So at least in the short to midterm, the way I think about it is partnerships. Are there partners out there with capabilities that complement our capabilities where we both win by working together, right? They're the experts on that side. We're the experts on this side. Let's bring the two parties together. I think as we continue down this journey, and when I say long-term, I don't mean like 5 years, I'm thinking beyond 5 years, because this will take different capabilities. It will take different talent. It will take different regulatory pathways, to be honest.
Sure.
And I think if we see the promise of technology in healthcare really play out over the next 5 years with these partnerships, I do believe that some companies will be in a position to have broader offerings. Again, with the focus around the actual medicine, I believe, but with the adjacencies to help make the value proposition of that medicine or that vaccine or that portfolio of medicines, more valuable to our customers. So I don't see it happening in the next 2 years. I do think that's, certainly possible in the future.
But so in a way, at one level, do you see the definition or the raison d'etre of pharma actually changing from developing great novel biologics or chemical therapies, synthesized chemical therapies, whatever they are, right, to one that's simply saying, I'm going to look at the disease as a whole, and therefore I'm a health solutions provider as opposed to a pill or a drug. And you could pick either one ultimately, because you could say, do what you do best while you create and partner elsewhere. The onus will fall on pharma also because of payer pressure, saying the only way you can demonstrate outcomes is when you kind of do the whole ecosystem.
Exactly. So I do still see, as you mentioned, the molecule sort of at the center of what we do. That's our core competency, right? Is it possible that companies will evolve to having disease solutions that don't include the molecule? It's possible. But I think from a core capability perspective, it's more likely that the disease understanding we have from the labs, the data we generate from our own clinical programs and our recruitment and screening, I think it's more likely that the industry or many in the industry will build solutions around the pill versus standalone solutions, right? I think the other pieces, there's also, there's many players in the disease solution space, right? Payers can start creating a lot of these solutions without the medicine. And they would be in a very credible place to go out to their members and say, we've got this disease management solution for you that can really help you get to better outcomes. So that's where I sort of go back to what the core competency of pharma is. And I really still think it's going to be around that sort of molecule or vaccine.
Perfect. And, when we talk about innovation, one question around that before I go to one or two of the questions that have appeared in the chat window, but there are great rewards if you're the innovator, right? First out of the block, great rewards for sure, but obviously the risks are higher as well. So, and there are times when it makes sense to perhaps be a fast follower rather than the innovator, right? Is there a model by which you decide which one you want to play in different circumstances, or is it just very seat of the pants kind of stuff?
Yeah. So I'll say in a world where there are unlimited resources, so not the real world, especially in pharma, our mindset is always first in class, best in class, right? We're all about innovation, be the first one out there and be the leader. That's sort of the mindset as you think about how we look at drug development. Now, in a world with restricted resources, which is the world we live in, I think about it more in terms of if there are 2 or 3 opportunities that we think are really going to change the game for patients, for systems, and for Merck, for example, I can speak to my company. Those are the areas where we will invest and take that high risk, high reward bet, right? Because typically the areas of greatest unmet need are also the most difficult to accomplish. And like you said, higher risk and also resource intensive, right? So that's how we prioritize. If there's something really worth it, we're going to go all in. For the other things that we can't resource, because it's very hard to do 100 things well, it's easier to do 3 things well. I think this notion of fast followership is very valid, right? Other companies clear the path for you. They come up with very valid sort of innovations that can be meaningful, that you can leverage and learn from. Don't need to recreate the wheel. And there's always opportunities to take, as a fast follower, to have incremental innovation on top of that, which is a lot lower risk, a lot lower cost, and a lot faster. So I'd say that's sort of how we think about sort of first versus fast follower.
Got it. All right, let me take a question from the audience, and this is interesting. A lot of people who want to work for you would want to basically know this. It's like, what do you look for in new talent that you're bringing in? What are some of those core attributes? If I were interviewing with you, what would you be looking for?
It's a great question. If I had to boil it down to one attribute, I'd say it's problem solvers. I love sort of that growth mindset, people who can come in, identify a problem, and work with teams, right? No one person can solve any problem, but like work across the teams to figure out how can we solve the problem and how can we look at it with a fresh perspective. So I'd say problem solving is high on my list. Of that sort of positive attitude, growth mindset, and that collaboration. Okay,
good. So you've given that's a cheat sheet for everyone who's going to basically ever come to an interview with you in the future.
Exactly.
All right. Here's we talked about data and analytics, and clearly that again, I'm coming back to something which is central to what we believe is going to be at the heart of transformation. And key thing, as you mentioned, is about trusting the data insights, and that being one of the challenges. So are there any pointers as to how you and your team were able to overcome some of those, shall we say, that mindset kind of barrier that we all have at one level? How did you kind of do that?
I'll start by saying we're still in our journey. So we're still early in our own journey, right? I think, and that's a big learning, that you can't expect everyone to just trust the data or trust the leader and move forward, right? So it's a really important learning around sort of pace of change and how to fit this within the culture of what has worked. So I'd say, tangible examples of how to move forward, experiments, right? If you do an analytics project that tells you you need to change your resource allocation, we like to do it in smaller settings. So instead of going to a whole country, pick a state or a city or a town, right? Set up the test and control, wait for that data to come back, and actually go back to the business and say, here's what we learned. We implemented the insights and we actually saw a 5% lift in your business, for example, right? That takes time, because when you experiment, you've got to actually collect enough experiments and also have enough time to collect the results to get that momentum is one piece. I think the other piece is, then how do you share those examples broadly across a global organization to continue to inspire people of what's possible? So I'll say we're still early. Those are the areas that we're focused on. How do we start just getting some priority sort of projects out there? How do we measure the outcomes of those? And then importantly, which is a very, very big important piece, is, and how do you communicate that and inspire people? And I think it's easy to get caught up in the, I just want to do the work. But the change management element is equally important, and it's often overlooked.
And are you seeing more traction in that adoption in areas like, let's say, using real world evidence for specific patient hub services, or are you seeing it more for commercial analytics as it relates to segmentation, targeting of physicians, or are you seeing it more on the R&D side, where it's coming into patient recruitment, trials, or anything else?
Yeah. So I'm seeing improvement across all of the areas that you mentioned, right? I'd say everything from R&D to commercialization to even supply chain, how analytics is being better utilized. I'd say within commercial analytics, this whole notion of segmentation, especially on the physician provider side and the consumer side, is probably the most advanced in my experience, right? Like people are very comfortable starting there. Where future opportunities will be are things like pricing, contracting, right? Pipeline prioritization, forecasting. So it's sort of broadening what is the scope of the questions you can answer as well, because those are sometimes perceived higher risk areas to trust the data. Whereas segmentation, I think, we've actually been leveraging analytics much more over the last 5 to 10 years than in some of these other areas.
Got it. And, I'm going back again to the whole digital, omni-channel, multi-channel, whatever you want to call it. And you mentioned that, in some cases, for instance, rare diseases companies are an inspiration to learn from because they are willing to experiment. They don't have necessarily the same, what works for a larger therapy area kind of molecule won't work for that, right? But I mean, do you see specific classes of molecules or categories where in future we would probably do a digital only launch of a product as opposed to more of a Salesforce driven hybrid kind of launch model?
So I'll speak at a global level. I think different countries and different cultures are in different places. So do I see some countries going to more of digital forward launches? Absolutely. Do I see a world where there's no sales reps in these countries? Not sure yet, right? Because what we're seeing is when there's a launch or a major market event or new piece of data, and some of this might still be habit, right? There is this sort of appreciation for, and I think we're all human, a dialogue, a two-way conversation, and that trusted relationship. Again, amplified by digital assets and omni-channel experience. I would say then for products that are inline, where you don't have as much new sort of data, that might be where in many countries you can go to more of a digital operating model. But it is very variable by country. Even if you look at sort of different regions of the world, there are HCP preferences that override sort of, whether you have the capability or not. So I think you'll start seeing more and more of that. I think you'll see Europe probably as a front runner in some of the more advanced digital pieces, followed by the US before the rest of the world catches up.
All right. I'm down to my last question. I'm going to ask the one, actually it's a fitting one to kind of end this with, really, and it's coming on the chat window, so I'm not taking credit for this one, but it says, any suggestions for aspiring leaders as to what their role in leading this change in their organization, given that the workforce has become remote and distributed? And we were talking about it before we got onto this chat. That the fact that technology is ubiquitous, it's readily available. How do they approach this? How do they differentiate themselves and their team?
So I always start by saying, be bold. If you believe in an idea, if you have a vision around sort of how to bring digital capabilities forward or advance them in your company, be bold, speak up, don't be afraid to challenge the status quo. And then the second piece of that I would say is, as you think about your teams or even yourself, really invest in learning. I will say, I've taken courses and learned things about, machine learning and AI applications in healthcare, even at this point in my career, because the capabilities in the digital space and the analytics space are moving so fast that not everyone's going to be an expert, right? And nor should everyone be, because you need those customer experts. But I'd say make sure you're surrounding yourself with diverse skill sets. with that growth mindset and that willingness to learn, whether it's within your teams or with partners. And the last piece of advice I'll give is be resilient. Whenever you try to change anything, the first answer is likely going to be no, right? And sometimes it's just a test of how much do you really believe in this. Sometimes it's just habit. Sometimes it's we're resource constrained. But I'd say stick to your North Star, be bold, and be resilient. You're going to fall down 10 times, but when you do get back up, that's when you start chipping away at changing the culture and changing the way that we do business in pharma.
On that note, it was really well spoken. And Arpa, you've been a fantastic guest. Thank you so much for sharing this hour with us and for speaking from your heart. Really is wonderful. And we look forward to kind of seeing more and more spectacular achievements from you. Thank you so much. I'm sure our audience really appreciates the time spent with us.
Thank you so much, and thank you for having me as well.
Thank you, and thank you to the audience. I'm sure you had a wonderful time listening to Arpa. Thank you, stay safe, and enjoy the rest of the summit.